Today I'm going to talk about collaborations for knowledge communication. Collaboration, I mean stakeholder engagement. And knowledge here, systematic review findings. So I would like to share the experience of Epicenter in conducting a review on Lyme disease. So this is an evidence map and 4 systematic reviews and an extensive stakeholder engagement. This project was commissioned by the Department of Health in England and garnered significant interest among policymakers, healthcare professionals, public, patients, and academic researchers. Next is an overview of Lyme disease reviews. So we started with a map that describes the nature of available research on Lyme disease in humans. And from the map, we identified 4 areas suitable for in-depth review. Review 1, Lyme incidence and surveillance methods. Review 2, stakeholder experiences of Lyme diagnosis. Review 3, stakeholder experiences of Lyme treatment. And review 4, effectiveness and UK applicability of Lyme prevention interventions. And we had an extensive stakeholder engagement. We worked with 8 UK patient advocacy groups along with review commissioners and another advisory group. So this is the web page from the Epicenter, and you can see all the reviews map and all the information is there in this web page. So the background, little bit of background about Lyme disease. Lyme disease is caused by a bacterial infection transmitted by ticks. Infection occurs after a bite from an infected tick. Evidence suggests rising Lyme disease rates. Uncertainty remains about its true prevalence in the UK, and lack of clarity on how widespread Lyme disease is in the UK, best methods for prevention, diagnosis and treatment, experiences of patients and healthcare professionals. Next couple of slides, I would like to talk about why do we involve stakeholders in general. Then I will come back to the specific review context. So, stakeholders help to expand perspectives, to incorporate varied viewpoints for a richer understanding about the topic. It exposes and addresses biases. Involvement of stakeholders promotes transparency and critical reflection, like what questions are being asked and why, who shapes the framing of the issue. It enhances quality and relevance, ensures the review reflects real-world concerns and priorities. And an important point here is to improve accessibility, translates technical language into understandable terms. They always help in that process. And very important here is to boost dissemination, encourages broader sharing and uptake of findings. And it represents those most affected by the issues and challenges marginalization, brings forward perspectives often excluded from traditional research. So how might we involve stakeholders? You may be familiar with some of the techniques here, and we may use one or more techniques. Consultation, collaboration, control, and co-production. Active involvement in review activities. They provide insight, oversight, guidance as members of a review advisory panel. They help to set review questions, influence theoretical framework, and day-to-day review activities such as identifying studies, helps in communication, interpretation, and application of findings. So, an important principles we have to keep in mind is we can involve stakeholders at key stages of the systematic review process. So, coming back to the user involvement in Lyme disease evidence review, we had active collaboration with commissioners. We worked closely with review commissioners throughout the project that ensured alignment with their needs and emerging program. focused on identifying research avenues to support NICE guideline development on Lyme disease. And we also had a scientific advisory group, convened a group of UK and international academics and policymakers, provided specialist expertise and input on technical research questions, concepts and definitions, dissemination and impact strategies. Advisory group operated on an as-needed basis. And we also had an extensive stakeholder consultation, conducted consultations with patient and practitioner groups, and that helped to interpret emerging findings, and it ensured relevance to current UK experience with Lyme disease. So I would like to specify the stakeholder engagement in the three main streams of work. The first one is incidence and surveillance of Lyme disease. Patient advocacy perspectives on Lyme disease evidence, insights from surveys and consultations. We obtained feedback from 6 patient advocacy groups and focused primarily on Lyme disease incidence in the UK. Key concerns raised by stakeholders or the advocacy group members that evidence does not reflect the true extent of Lyme disease in the UK. And they also expressed challenges to accurate incidence data and the recommendations from advocacy groups. 3 groups called for improved monitoring of UK Lyme disease incidence, and 2 groups emphasized the need for better data on regional differences. The second review about experience of the diagnosis of Lyme disease, systematic review, patient advocacy groups' view on these findings. Stakeholders felt research findings reflected their own experience. 5 main themes from patient views research were seen as appropriate and relevant. Stakeholders provided additional insights that enriched these themes. Strong resonance between research findings and real-world experiences. Stakeholders confirmed the research addressed key issues and challenges. Feedback helped validate and enhance the thematic framework. The next review was on Lyme disease treatment, and I would like to highlight the patient advocacy group's views. They emphasized the need for future research on patients' experience with treatment, clinicians' experience with treatment, and lack of evidence on treatment experiences. There was a general lack of evidence on Lyme disease treatment. Most evidence originates from the USA, limited relevance to the UK due to different Borrelia strains prevalent in the UK. Desire for patient-centered research, frustration over insufficient UK-specific data, and they call for greater inclusion of real-world treatment experiences. Next work is about Lyme disease treatment, and we gathered views on key findings of Lyme disease treatment review. National awareness strategy. 3 groups called for a coordinated national strategy to raise awareness of Lyme disease. And role of advocacy groups. 3 groups noted that most awareness efforts are led by patient advocacy organizations. Evidence concerns. 2 groups expressed concern over the lack of UK-specific research evidence. Public awareness. Several stakeholders emphasize the need to inform the public. One warned that reluctance to share information could lead to panic. Tick removal evidence. A stakeholder highlighted the need for detailed guidance on tick removal. Mentioned conflicting research on timing and limited data on optimal methods. This is the website of a patient advocacy group, a charity group, Lyme Disease UK. They participated in the review and also they helped in disseminating the findings of the review. They have given a link and a description and highlighted the key points from the review for the wider public. We also noticed several social media posts highlighting the reviews and the key findings. Another charity also highlighted the key findings and helped in the dissemination process to the public. The impact of this uh, involvement of stakeholders and the reviews. The UK government and healthcare bodies have taken several steps to address various aspects of the issue. NICE guidelines, the National Institute for Health and Care Excellence, issued guidelines on Lyme disease to support healthcare professionals in diagnosis and management. And advocacy groups ran public awareness campaigns to educate the public about the disease. Ongoing research continues to expand understanding and inform practice. We had several academic publications, conference presentation, help to disseminate findings and foster scholarly dialogue. And this particular review and the extensive stakeholder engagement contributed to methodological development as well. So the key messages. Stakeholder engagement is recommended when conducting systematic reviews. It is important to decide the level of engagement based on various considerations ranging from consultation to co-production. It's a thoughtful selection. We need to thoughtfully select the stakeholders and the key players. Involve stakeholders in key decision points when conducting systematic reviews. Example, planning stage, finalizing the protocol, searching, etc. It's a complex process. It's not that easy sometimes to manage the stakeholders when the stakeholders are an extensive group. Mutual trust and respect are important. Have clear aims for stakeholder engagement. It can be challenging at times, especially with sensitive and contested topics. Ethical aspects must be considered. Information sheets, consent forms, guidelines for conducting stakeholder meetings, etc. Soft skills are essential for managing people. You all know that. Thank you for giving me the opportunity to share this topic with you. Thank you.